Well, welcome everybody. Welcome to our fourth podcast. I'm Dr. Troy Bell, joined by Dr. Jean Terrezza and Dr. Hannah Sahawneh. We appreciate you guys listening and viewing and certainly commenting and liking. And certainly any questions that you have, certainly we'd love to answer them and may even have a future podcast regarding that topic. But for today, we're going to get into myopia. It's Myopia Awareness Week, so we're going to talk extensively about that and hopefully answer any questions or concerns that y'all have out there with yourself or your kids, you know, what to do, what to expect, and that sort of thing. So I'll kind of turn it over. You want to introduce Dr. Sahawneh?
Yeah, I do. This is Dr. Sahawneh. I'm pleased to have her as a special guest. And if she'll tell us a little bit about yourself and how you've been trained and whatever else.
Well, thank you for having me on. I really enjoy what you're doing here. I grew up in Iowa, and I went to Iowa State University for my undergrad, graduated with a degree in kinesiology, and then I went to the University of Alabama School of Optometry in Birmingham, graduated there in 2018. And then I went to New Mexico and did an ocular disease residency in the Gallup Indian Medical Center, and did that until end of 2019. And that's when I joined the real world, got a job, and moved to Pensacola. And I'm happy to be here.
Well, we're happy to have you for sure. And it's been really good to have you there working at the offices and seeing, you like the kids, so you see a lot of kids, I think, right?
I do, yeah. And that really came from my schooling at University of Alabama. They had a great pediatric program, and then working with the kids on the reservation, I really enjoyed seeing all the pediatric patients, and that's, I think, where we can make a big difference from many patients when they're young going into life.
Well, do you want to start? Let's just, I guess before we get into it a little bit, let's just talk about what myopia is. You know, what should parents expect, you know, when their kids complain? You know, what do kids experience? Just kind of define what myopia is and kind of things for the parents to look for.
Mm-hmm.
Well, myopia affects 30% of the world's population, so it's the #1 eye condition in the world. It varies. Asians tend to be more nearsighted than other races are, but certainly there's a wide distribution. And that poses problems with people doing a lot more computer and screen work these days than they did in previous generations. And therefore, there are methods to address that and perhaps decrease its intensity early in their pediatric life cycle. So Hannah, why don't you tell us some about that?
Well, myopia is nearsightedness, and the way I tell patients is your sight is at near, so it's easier to see up close than it is far away. Things are blurrier far away, which really poses a problem to kids in school, especially when they sit in the middle or back of the class. And a lot of kids don't know to complain or know that that's not normal to see blurry far away. So I do like to remind parents and kids and everybody and teachers that it's not something that's readily caught or known by kiddos. They just think everybody sees the way that they see. So it's not something that does readily get noticed by kids themselves. Usually it's a parent or guardian or teacher noticing them squinting or getting closer to items, things like that. That's usually the first tip off there.
Well, I mean, sometimes you ask kids, and we do this every day, you know, how do you see, or, you know, what do you think? But they have nothing to compare to. So, you know, who knows? You know, they don't know what good is if they've never seen really good. Mm-hmm. So, and then the other case is some kids, maybe one eye is good, but one eye is not so good, and they don't even notice that until they cover up an eye, and we kind of figure that out. But I think there is a big misconception between nearsighted and farsighted. I think most people kind of get that backwards. But to your point, if you can't see things far away or have a harder time seeing things out there, that is most likely nearsighted. Because it's easier, like you said, to see it near, harder to see things far away. And so it's important to bring these kids in so we can get them seeing well, because they may shy away from work, they may shy away from doing schoolwork, or, you know, sometimes they don't complain, they just don't do something because they feel bad that they can't see it. And at that age, especially young ages, we want them to learn, and that's a big, important time of their life to learn the things that they need to learn. If they can't see it, certainly that's a problem.
I would piggyback on that about different signs versus symptoms, as kids don't really complain because, like I said, they don't know, or if they have one good eye. Some different signs are along the lines of even a child missing certain depth perception cues, or if they're running into things, tripping over things. There's even some parents have said, my kid doesn't look directly at me when I'm speaking to them. They're kind of looking around me because they can't see my face, or they didn't know they couldn't see my face. But certain types of gazes can also tip parents off, or teachers, I've had a lot of patients who have said they just ask their students next door to them, say, hey, what does the board say, or have to copy off, things like that. So there's little things along the way that can kind of tip people off in their life that there is something that needs to be addressed.
And so oftentimes, let's just say it's someone who's like -1 or low nearsighted, and we can correct that patient, or we're saying kids, but anybody could be nearsighted. But certainly it could be glasses. We just get them to help them see. It could be contact lenses if they're of age and mature enough to handle that. But taking that a step further is, when should a mom kind of be worried, right? What is normal? How much? Because I think a lot of parents think, hey, it's normal for my kid to progress, but at a certain point, when is it abnormal? When should they be concerned, and that sort of thing?
So there's no really good normal anymore, and that's why we're doing this, and why there's myopia awareness, and that's why there's a really big push in the industry to talk about myopia, because the norms of 10, 15, 20 years ago no longer apply over the last 3 to 5 years. And that's a big point to make, and that's why there's so much awareness going on. And actually this week, CooperVision just said and announced their whole new initiative with myopia, and to start identifying myopia change agents and really giving a good push to the standard of care that surrounds nearsightedness and myopia. And so that's really big to know, that there's no really standard normal anymore, because there's such a new prevalence of it. And so to answer your first question of when should a parent be worried, I never try to worry a parent. I never want to tell a parent it's time to worry. I always try to reward a parent or a guardian for saying, it's a great thing you brought him in, we're catching this now, let's talk about what we're seeing right now, and then we can talk through other things later on if we need to. So I never try to worry a parent or tell a parent to worry. The only time I would get nervous is if during that exam, yes, they're nearsighted, but then we find other things. And that's another reason to bring children in for exams, is it can start off with a visual issue, but we can find other things that need to be addressed. And so that's when, if any time to be worried, it would be that.
Well, one of the things you always say is, we talk about screen time, right, on phones and computers. What's the general rule for someone who's looking at something? We always say, as far as taking breaks, how often should I take a break if I'm on the computer or the phone, and that sort of thing?
They call it the 20-20-20 rule, and that is that if you work for 20 minutes, you should take 20 seconds off and look at something else and go back to it. One other point I wanted to make, though, with the children, was that a lot of psychology studies have been done on children who are nearsighted. And it's pretty much like, what came first, the chicken or the egg? The child's perception of himself, his self-esteem, is a function of how well he performs at tasks. So someone who's nearsighted and doesn't do well on the balance beam, or at a certain sport, or things that are important to his peers, is seen as slow, unfortunately he internalizes this. And then they say, well, little Johnny's quiet. Well, little Johnny's quiet because he can't see worth a hoot. And plus, when he goes to do things, he's always picked last on the baseball team. And I think the subtle effects of this we shouldn't underestimate.
And that's not just anecdotally. There are our studies supporting the psychosocial, basically the developments in children that happen to their mental health because of nearsightedness, or the way that they've been handled around nearsightedness. So that's well supported as well.
So along with the breaks, and that's a very good point, is we talk about their studies too to show outside, and I think that's it's the outside in the sunlight, just going outside, which we used to do as kids, but I think nowadays it's lost where we're on the phones, we're spending more time indoors, and just going out in the sun or doing something outside can be one of the best things for vision therapy, for just releasing that focusing or accommodation that you're doing up close, just to give those eyes a break there just for a little bit.
Distance viewing, looking at the horizon, finding small targets, tracking them across things, those are all things that help our eyes maintain their farsightedness, or ability to see far away. And that's, again, really well studied now. They've studied children who live in rural outdoor areas versus very urban indoor areas, and that's where a lot of those studies are coming from and why these recommendations are now well supported. And they say about 2 hours of outdoor time a day or 11 hours a week is where they can really find that line of significance. And so easier said than done, but about 2 hours a day if you can get cumulative outdoor time. But that's outdoor viewing looking far away. That's not outdoor reading a tablet.
We used to stay outside until it was dinner time until we came home. We were outside the whole day, but I guess it's changed a little bit nowadays.
Very much so.
But that is something that's now supported as well.
Well, and there's a couple different avenues, and this is open to all of us, but what are some things to worry about in general as far as myopia? What could myopia cause? What could it do to the eye? We can tell, and we can break down what myopia is as far as, as far as the actual link in the eye, but what could it lead to and what concerns should someone have?
Glaucoma is one of the biggest ones. So if you're nearsighted or have myopia, you have a 50% higher chance of having glaucoma, which is a sight-threatening condition. You have a 17% higher chance of getting cataracts earlier in life. And then you also have, for a retina to detach, you have a 6 times greater risk of a retina detaching. And again, that is a sight-threatening condition as well. So those things, the higher you have more nearsightedness, the higher your chances are.
Why is there an increase in retinal detachment for someone who's nearsighted?
That's a great question because it comes down to the anatomy of why an eye is nearsighted in the first place, and it's the length of the eye. And so the longer an eye, typically the more nearsighted it's going to be, the more stretch of a retina, the longer, the more pull on that retina, and that can become a risk for a tear or a detachment.
And that goes with one of the things we always talk about. Certainly, we're going to check glasses and check vision every time we see you, but that's the reason we want to dilate you and look in the back of the eye as well to kind of make sure there's no signs of traction, tears, holes, detachments that could be happening. Okay, especially for when we're talking about myopia, having that greater risk, we want to look at that retina, especially all around the aura, and just make sure there's nothing going on that could lead to a detachment or if there's any signs. And so that's the reason we always want to look inside the eye and make sure of that.
And on kiddos, dilating them when they're young to really ensure they truly are nearsighted as well. And so not only are we checking the retina, but sometimes we can get a false sense of nearsightedness or farsightedness. So dilating kids is highly recommended. I think that it surprises a lot of parents that we want to dilate kids even as young as 1-year-olds. And that's something that to help us get a really accurate prescription and check the health of the eye and make sure we're not finding anything else. Dilating kids is, I think, one of the most important parts of the eye exam.
No, that's exactly right. We talk about the health part of dilation, but it does give us a more accurate measure of the prescription, knock out that accommodative part for patients who are latent hyperopes, but in this case, myopes, to get more of a true prescription of what we need to give that patient.
Couldn't agree more.
The length of the eye, kind of circling back to that, is something that we have a normal length at birth, and then we know that as a kid grows taller, their eye is going to grow longer, which is normal, and that means the power of the eye should eventually get to a point where they can see perfect. And that's in a really normal eye. We know in a nearsighted eye, the length of that growth and that growth rate is really exceeding the normal rate. So the eye is growing a lot quicker than it should be. They're jumping over that perfectly 0 point and going into the nearsighted category. And that's where most of the preventative measures are aiming to slow that down, is the lengthening of the eye in that retina.
Well, this is kind of putting you on the spot, but is it a true statement that saying, let's say a kid that's 8 years old is -1, and then he goes to 9 and 10 years old and it goes up to 150 or 2. Is it normal, A, for that kid to increase in myopia as he gets older, right? And then 2, why should some parents worry if it's a normal increase? How much of an increase does it take for a parent to say, hey, this is beyond the norm, that sort of thing?
So I will start with the answer that there's no safe power of nearsightedness. So there's no number or power that we know is okay to be nearsighted without having any extra risk. So in my head, and what all of these are pushing towards, is that because there's no safe number of nearsightedness, it's worth addressing no matter what number that child is at. And if we have an 8-year-old at a -1, I would expect that kid to keep growing because they're nowhere near done growing at that point. And so we would expect that to keep jumping further and further ahead. Now the rate of that progression, or if we can slow that down, or if we can stop that prevention and prevent that and prevent the progression of it, that's where this whole new initiative is aimed towards getting more and more doctors to bring that up to the parents. Because I think it is relatively accepted that every year we think, oh, it's just going to get worse and that's normal. And so that's the norm that we're trying to break now that we have all these statistics saying there's no safe amount of nearsightedness. There are risks to every type of growth, and that's what we want to start preventing any sort of normal of it being higher and higher and higher.
No, that's a good point. I don't know if you would agree with this, but I would say for me, doing this year after year, I usually don't get too alarmed if it just goes up a little bit, but certainly if there's big jumps, those are the patients that I kind of get more alarmed about. But hearing her talk, I need to, any increase is not good, as far as these kids.
Oh, I think that I'd like to hear what Dr. Sahawneh says about the procedures that have been FDA approved to help stop some of this, as opposed to just theories, which is all we had prior to this.
So there are 4 types of prevention or progression or treatment that we know of right now. Most of them are aimed at that lengthening. So when we talk about nearsightedness, most of what we're talking about is the lengthening of the eye during those growth cycles as children. So that's something that a lot of that's aimed at the pediatric population. And that's why it's, again, so important for kiddos to come in and get seen. So one of the first ones is going to be soft contact lenses. There's been a new FDA-approved soft contact lens. And I know that sounds crazy to put a contact on a child, but it's very well studied. They're daily disposable contacts. It's aiming at what it does is it essentially puts a blur circle or a peripheral defocus on the child's retina to stop the cue of growing farther and farther. So that's one, a soft contact lens. Another one is a dilating agent, but it's a very diluted dilating agent. And that one actually isn't technically FDA approved because nobody owns that drop and isn't putting it through the FDA, but it is highly recognized across many, many journals and reviews, and that's something that is recommended and is seen as forms of preventative treatment. There are a lot of studies on if we should even start kids pre-myopia. So if I have a 5-year-old coming in around 0, but we know that that 5-year-old's going to keep growing and likely go into nearsightedness, should we initiate treatment with an eye drop at that time? So there's studies on that, questioning that. And then there are different glasses that there are some studies on as far as a progressive or bifocal glasses to help the kids use a relaxing magnifier instead of their own eyes when they're focusing up close. Those 3 are aimed at preventing myopia from worsening.
Okay.
And then the 4th one is Ortho-K, which is kind of like an orthodontic for the eye. It isn't aimed at actually slowing the growth of the eye, but once an eye is nearsighted, it can change the cornea to essentially try and make it so you don't have to wear glasses or contacts during the day. And so that's a hard contact lens that you would sleep in overnight. So those are the 4 recognized categories of prevention or treatment at this point.
So I'm correct, you are certified in doing these procedures, is that correct?
I'm certified with the MySight contact lenses through CooperVision, and then I've recently applied to become a change agent in the myopia control world with the actual American Optometric Association. And so that's something that's going out. And I've applied to do that, so fingers crossed.
I see.
So let's see.
Well, I remember umpteenth years ago when I graduated school, I remember us talking about certainly myopia and regression at that point, but I think it's come back around full circle now because we realize that more of the population is becoming nearsighted, a higher percentage overall, and certainly I think kids in general at a younger age are becoming more nearsighted. And so it's been kind of, doing a lot of studies, and I think I've read quite a few, and some point to all this near work as far as on the cell phones. Some disagree, but there's something in general that is certainly causing kids to become more nearsighted at a more rapid rate. And that's the reason this is also important, is because, it seems like it's only going to increase unless something is done.
And that's something that they've had a ton of studies coming out now, is that with all of the shutdowns from COVID, I think they estimated nearly 75% of kids were at home online learning and doing digital learning. And so that's where a lot of these studies are coming from now.
Well, I think we covered it pretty good. Anything else you guys want to add that we didn't cover? As we talked about myopia, what it is, certainly what to expect, certainly to bring your kids in. I mean, the main thing is if there's anything that concerns you, anything that concerns, certainly bring them in. Let's do the exam. Let's figure it out. Certainly you can ask us any questions. We want to go through this because certainly we want to get these kids seen and get them corrected and get them healthy and get them staying like that as long as they possibly can. So certainly come in, TerrezzaOptical.com. We've got multiple offices. We can certainly help you with insurance. We take pretty much every vision and medical insurance. And I just want to say, certainly thanks for joining this podcast. We appreciate it. Like us. Thanks for Dr. Hannah Sahawneh joining us on this myopia.
Absolutely.
Dr. Jean Terrezza, we appreciate you guys. And stay tuned for our next one.